Off my right, we have 3 incredible studies. Now, albeit maybe phase 2 or pilot or however you want to word it, the outcomes were just incredible. Now, every once in a while, I like to cover this grouping of research articles because they tend to be short in duration, but important to be maintained upfront in the media and easily available per se regard to search engines. So, without what we've been doing this close to about a decade now, and yeah, many of these great studies and breakthroughs get lost, but sometimes they don't. So, let's keep it in the fold. Moving forward, let's look at the research articles as follows. We have a phase 2 trial we want to look at in reference to a medication called afimetoran, reference to lupus. This was an animal study. We're going to review a little bit more in depth in a second. In this animal study, it was actually able to mitigate many of the damaging effects of lupus, as well as potentially reverse some of the organ damage as well. After that, we're looking at basically restoration or improvement in long-term or working memory by simply just using electrodes on the scalp for about 20 minutes for 4 days. The beneficial effects were seen to last at least a month. And then an incredible article in reference to a secondary hypothesis. What they looked at basically was resistant starch fiber, RSOC, in reference to the research article. And they were looking in regard to Lynch syndrome, which is a colorectal type, a hereditary colorectal type cancer. Now, the weird part about it is even though it didn't work on the primary hypothesis to show any mitigating effects in regard to that type of cancer, the secondary hypothesis was quite amazing because it's shown to actually reduce the occurrence of cancers over 10 years, other cancers I should say, besides the colorectal, by as much as 60%, just from individuals taking this resistant starch fiber for about 2 years. The beneficial effects past the 2 years lasted about 10 years. So without further ado, let's get into the first research article as follows. Lupus pill shows promise in mice clinical trial underway. Scientists report they've begun phase 2 clinical trials of the pill containing a compound that in mice not only prevents lupus-like symptoms, but also reverses signs of organ damage caused by the disease and prevents death. Oh, it gets better. I'm going to take a little bit of highlights from the article. And also, too, I'll have a link to the article. And from the article itself, you can go to the DOI citation and go further into the full study if you'd like. Goes, the researcher present the results at, again, reference to the American Chemical Society. Thank them. Quote, with the afimetoran, not only could we prevent the development of lupus-like symptoms in mice before their disease onset, ready for this? But we actually reverse the symptoms. I want to reiterate this, an animal model has to be carried out to humans. Reverse the symptoms and prevent death in animals that were days or weeks away from succumbing to the disease. I'll leave that for you to read over on your own. Dykman says, quote, we hadn't seen that reversal with other mechanisms which we had evaluated, so we're particularly excited about the finding. Dykman says he believes the combined effects of afimetoran given to the potential to control lupus as well as better than existing treatments and do so through an oral delivery, not an injection. As you read the background story in reference to this medication, which is being produced by Bristol Myers Squibb, again, these are just tools. So whether you're allopathic or naturopathic, once that door is open where you could see the damaging effects of lupus being reversed, it's interesting how that void begins to be filled with tons of other potential remedies, per se, either allopathic or naturopathic. But to proceed, as opposed to require an injection or infusion. So again, what I'll have is the DOI citation, not DOI, the link to this article, and then from there go to DOI citation. I know a lot of people are feeling at a loss in reference to basically lupus. That's why I found it very important to bring this to your attention. But I want to reiterate, or iterate, I should say, phase 2 clinical animal has to be brought to human trials, but still just the same. Afimetoran is the one that you want to be looking out for. And it's really interesting how to discover this particular medication in regard to it. But The outcome showed it is possible, at least in an animal model, to, as they say here, prevent death as well as reverse the symptoms. And of course, also to reverse signs of organ damage. To proceed, can we reverse the effects of age-related memory loss? Quote in the title, experts say yes. What the study found. In a recent study published in Nature Neuroscience, Reinhardt and his team of researchers explained how their non-invasive treatment, we're not talking medications or drugs or supplements, we're talking a non-invasive treatment, basically delivered through electrodes in a wearable cap. You see how easy this can basically be once it can be produced in a consumer model? That's where I want you to kind of imagine, because something like this, so simple, like that, in an easy format in which an individual to use, that's incredible. But proceed. In a wearable cap can improve memory function in older adults and gets us one step closer to providing a more efficient treatment for memory loss. Quoting, we delivered our non-invasive treatment to target memory function through scalp electrodes and found that electrical brain stimulation for 20 minutes on 4 consecutive days can improve working memory and long-term memory. Working memory as opposed to where's my car keys, stuff like that. And long-term memory in individuals 65 years and older for at least a month. 20 minutes, 4 consecutive days. Results last at least a month. Now, obviously, people are going to say, well, what if we did it every day? How would this improve function for a longer period of time? Again, that's for future research to see. In the beginning, if you look at the other research, they didn't have as much success, but let me proceed forward before we complete the article. Lower frequency electrode activity improved working memory on day 3 and day 4 and 1 month after intervention. On the other hand, high frequency improved long-term memory on days 2 and 4 and 1 month after intervention. So basically, our findings demonstrate the plasticity of the aging brain can be selectively and sustainably altered using these 2 treatments. Now, the word you want to focus on here is plasticity, because what you hear often as a person takes more trips around the sun, the brain plasticity begins to not be as plasticity-like, so to say. All right, so basically that begins to basically not be have that effect. So learning and development and adapting to their environments tend to be, how would you say, eroded to some extent. But with electrical stimulation, they could demonstrate that the plasticity of the aging brain can be selectively and sustainably altered. Now that could open doors to many individuals, reference to individuals learning, schooling, so on and so forth, in this, without any publisher bias. In this case, we're stuck at 65 and older. Imagine how simple something like that would be. And without, at the same time, without any publisher bias, not any confounding, not interfering with any other medication, because it's not a medication. It is basically a non-invasive treatment in 20 minutes a day for 4 days straight with a little bit of electrodes and a baseball cap. Wow, that's incredible. Now the next one is interesting as well, because the reason being, it wasn't the outcome they were looking at. Now they did research in regard to aspirin and resistant starch fibers. All right. And I'll show you the resistant starch fiber towards the end, which you may already see highlighted there to begin with. But it's a combination effect. So the aspirin had a beneficial effect in regard to this Lynch syndrome. And we're talking hereditary type colorectal cancer. But the effect, at least in the individuals which are basically hampered by this particular hereditary disease, is amazing. This is really, really incredible. Now, let's see confirmation. This is a secondary outcome. You may say secondary hypothesis or secondary outcome. Your wording is just as good as anybody else's. But still, it's phenomenal. Here we go. Are you ready to proceed? It says as follows. Cancer study. Major preventive effect from resistant starch in people with Lynch syndrome, which again is hereditary non-polyposis colorectal cancer, which is the secondary hypothesis we're looking at. An international trial known as, we'll just say CAP2, involved almost 1,000 patients with Lynch syndrome from around the world and revealed that a dose of resistant starch, also known as fermentable fiber, taken for an average of 2 years. Now, people are going to think, well, there's lots of different fermentable fibers out there. But keep in mind, I don't want to add publisher bias, so I want to basically only utilize the one that was recommended or utilized in a methodology. So again, I want to stick to pure focus on what was done in the study. The regular dose of resistant starch, also known as fermentable fiber, taken for an average of 2 years, did not affect cancers in the bowel. All right, so we know that. But, here's the but, did reduce cancers in other parts of the body by more than half. The effect was particularly pronounced for upper gastrointestinal cancers, including esophageal, gastric, biliary, pancreatic, and duodenum cancers. Now here's the kicker. As you look down to the article, the astonishing effect was seen to last for 10 years after taking the supplement. 10 years after. And as I said, found below, please excuse me, that's my cell phone and texting coming in. We found that the resistant starch reduces a range of cancers by over 60%. I don't know what other supplement, medication, whatever that you can take where the effects are so pronounced over a decade that you stopped taking many years ago. 2 years. Now here's a little bit of the data. Remember, methodology, we looked at the full study to see exactly what they did. And they used 30 grams RS, resistant starch, of basically a fiber called novelose. Doesn't mean there's not other alternatives out there or other pathways per se with other types of fibers. I just want to recommend the methods that they use, not promoting any brand or nothing like that. We make no money, you know that. But however though, just the same, but be pure without any publisher bias. The ones they used was resistant starch from novelose. That's what they did. And they used 30 grams per day, and at 30 grams a day for 2 years, had the effects that last at least 10 years of reducing a range of cancers by 60%. That's what I mean by groundbreaking studies. These three, basically afimetoran from the lupus, and reversing organ damage, and basically saving animals that just days or weeks away from succumbing to the disease itself. The electrodes, and just simply a cap at 20 minutes a day for 4 days straight, having the effects that last a month, and then to extend it out to long-range impact of either supplementation per se, a simple resistant starch fiber, reducing a range of cancers by 60% or over, quoting the researchers. These are incredible groundbreaking studies, incredible outcomes. These are worthy of highlighting the medical sections of many newspapers. But often there's a research inundation and things get lost in the fold where attention's focused other places. But hopefully for those watching this video channel, which again, I'm grateful, thank you. And I'm always grateful that you watch. Even though again, we don't make anything of the channel at all, but still just the same, it's motivation. And as well too, again, as always, gratitude to the researchers. Again, whether it's a medication or whatever it is, all I see them as is tools. And whoever the best tool is for an individual, basically, whether it be supplemental, allopathic, naturopathic, traditional Chinese medicine, whatever, basically, or any other shamanistic form of medicine per se, if it works, I remove my bias and what is best for the individual itself. And that's the way it should be overall. Best tool for the job should be the first option for the individual. Gratitude, thank you. Look forward to you all once again next week. Catch you then.